Hi, my name is Carlton Whitmore. I'm Director of the Office of Consumer Affairs for the New York City Department of Health and Mental Hygiene. I am also a member of the Stakeholders Board of the Center for Practice Innovations. Today we are going to talk about peer services in New York State. So what are our objectives for today? 1, to recognize the supports for peer services found in New York State. 2, to understand the peer certification process in New York State. 3, to understand the settings in which peers provide services. And 4, to identify resources for peer services. The Substance Abuse and Mental Health Services Administration created a national consensus statement on mental health recovery. The following statement was derived from deliberations by experts on the findings. Mental health recovery is a journey of healing and transformation, enabling a person with a mental health problem to live a meaningful life in a community of his or her choice while striving to achieve his or her full potential. Let's talk about the role of peer specialists in the recovery paradigm. Peer specialists are current or former recipients of mental health services who work as paraprofessionals, providing direct services to recipients in emergency, inpatient, outpatient, community support programs, and residential settings. A peer specialist is an individual with lived recovery experience who has been trained and certified to help their peers gain hope and move forward in their recovery. So let's take a look at some of the ways peers provide services. Peer wellness coaches help others identify and achieve their health and wellness goals. Recovery coaches are peer specialists who work in a whole health environment and serve as connectors to recovery support services, while addiction recovery coaches are individuals seeking to achieve or sustain long-term recovery. Peer bridgers help individuals with recurrent involvements in a variety of institutional settings, like psychiatric hospitals, detox centers, adult nursing homes, and jails and prisons, to make successful transitions into the community. Peer crisis support workers provide timely support to people in psychiatric crisis in a variety of settings, including phone-based peer support lines and peer crisis respite centers. While peer advocates are trained to help ensure reasonable accommodation, support, consumer self-determination, and shared decision-making, and assist individuals in accessing services and enforcing their human, civil, and legal rights in the mental health system. Forensic peer specialists are individuals living with psychiatric and/or addiction-related conditions who have histories of incarceration. They receive special training to work in jails, prisons, and jail diversion programs to assist people in avoiding future incarceration and in connecting them to their communities. The Centers for Medicare and Medicaid Services issued the following statement as part of a letter to state Medicaid offices encouraging the use of peer specialists. States are increasingly interested in covering peer support providers as a distinct provider type for the delivery of counseling and other support services to Medicaid-eligible individuals with mental illness and/or substance use disorders. Peer support services are an evidence-based mental health model of care, which consists of qualified peer support providers who assist individuals with their recovery from mental illness and/or substance use disorders. CMS recognized the experiences of peer support providers as consumers of mental health and substance use services can be an important component in the state's delivery of effective treatment. Again, CMS is reaffirming its commitment to state flexibility, increased innovation, consumer choice, self-direction, recovery, and consumer protection through the approval of these services. So what are some of the benefits of having peer support? Improved self-esteem, increased satisfaction with care, improved engagement for traditional alienated consumers, improved social functioning, increased access to resources and decreased stigma, greater gain in well-being, and increased self-efficacy and enhanced employment. In 2001, Georgia and Arizona were among the first states to be approved for Medicaid coverage of certified peer specialists, and several states quickly followed. CMS now recognizes peer support providers as a distinct provider type for the delivery of support services and considers it an evidence-based mental health model of care. Also in 2007, they issued a state medical director letter clarifying states may opt to provide peer-to-peer services through Medicaid and that the following items must be addressed. Supervision must be provided by a competent mental health professional as defined by the state. There must be care coordination within the context of a comprehensive, individualized plan of care that includes specific individualized goals. And finally, training and credentialing must be defined by the state, providing peer support providers with a basic set of competencies necessary to perform the peer support function and include continuing education requirements. So what's the New York experience? New York State has a rich history of providing peer-to-peer services through various non-Medicaid funding sources. They also have a diverse array of quality trainings throughout the state. In 1995, New York became one of the first states to develop a civil service job class for peer specialists working in OMH facilities. Between 1997 and 2000, with funding from the Center for Medicare and Medicaid Services, New York peers developed a process for accreditation of peer-run programs. In 2012, New York State made a decision to move mental health services into Medicaid managed care. And finally, to ensure continued opportunities for peer services, OMH has developed a peer specialist certification process in conjunction with New York peer leaders. Behavioral health has recently become managed care. What does that mean? Managed care already provided physical health care services for people with Medicaid. Now managed care also manages mental health and drug and alcohol use services. Mental health and drug and alcohol services are sometimes called behavioral health. So what do these changes mean? Behavioral health care, along with physical health care, is managed by Medicaid insurance plans. Managed care will pay more attention to behavioral health care to help people with behavioral health needs reach their health and recovery goals. People can get more behavioral health services in their community through New York's Medicaid managed care program. Doctors and other service providers will work together to help people meet their own health and wellness goals. So how will this impact where peers provide services? Home and community-based services, also known as HCBS, provide opportunities for Medicaid beneficiaries with behavioral health conditions to receive services in their own home or community. Health and Recovery Plans, or HARP, manage the enhanced benefit package of home and community-based service. HARPs will use HCBS to provide person-centered recovery services to eligible people with behavioral health disorders. Some of these services include rehabilitation, which includes psychosocial, community psychiatric support and treatment, crisis intervention, which also includes short-term crisis respite and intensive crisis respite, habilitation, service supports, which also include family support and training, and individual employment support services, which include intensive supported employment and ongoing supported employment, educational supports, self-directed services, empowerment services, and peer supports. Peer support services are peer-delivered services with a rehabilitation and recovery focus. Empowerment services and peer supports are peer-delivered services with a rehabilitation and recovery focus. They are designed to promote skills for coping with and managing behavioral health symptoms while facilitating the utilization of natural resources and the enhancement of recovery-oriented principles. Peer support uses trauma-informed, non-clinical assistance to achieve long-term recovery from substance use disorders and mental health issues. Some of the services that peers provide: advocacy, which can include assisting individuals with obtaining benefits and entitlements, benefits advisement and planning, outreach and engagement, which could include companionship and modeling of recovery lifestyles, self-help tools, assisting and selecting and utilizing self-directed recovery tools such as Wellness Recovery Action Plans, otherwise known as WRAP, and also individual recovery plans. Also assisting and selecting and utilizing the things that bring a sense of passion, purpose, and meaning into an individual's life. Recovery supports, like recovery education and coaching for individuals for their family members, also one-to-one peer support, transitional supports like bridging a person from jail or prison to a person's home. Also note, peer supports are not Medicaid reimbursable for individuals in jail or prison. And pre-crisis and crisis supports, like providing companionship when a person is in an emergency room or crisis unit, or preparing to be admitted to detox, residential, or other services to deal with a crisis, and developing crisis diversion plans or relapse prevention plans. With all these changes came peer specialist certification. Peer specialist certification is a process for acknowledging skills acquired by peers that qualify them to assist others in their recovery. It also includes standards for training and experience. It promotes a skilled workforce and establishes qualifications for professional recognition for individuals working in the mental health system. So what are the benefits of certification? Certification identifies professionals who are specialists in their field. Certified peers are recognized by professional affiliations, state and national legislation. Certified peers are provided with the opportunity for peer networking and educational opportunities. Certification also increases professionalism in the field. Certification provides a strong basis for employment hiring and professional advancement. Programs utilizing certified peer specialists may also be qualified to bill Medicaid. In order to meet the needs of peer specialists seeking certification, New York State established the Academy of Peer Services, also known as APS. APS is an online training platform for individuals delivering peer support in New York State. It's free of charge to persons who wish to work in the New York mental health system. Its courses are designed with peer leaders in New York, and it's developed in partnership with Rutgers University School of Health and Related Professions. So to summarize, New York State has a long history of supporting peer specialists. Peer specialists in New York have advanced to become respected workforce that provides a unique set of skills and supports for those receiving behavioral health services. Peer specialist services in New York State are now Medicaid reimbursable for some program types, and peer specialist certification is required for peers in New York State who want to provide those Medicaid reimbursable peer services. I'm Carlton Whitmore. Thank you so much for your attention.